Welcome everyone, Dr. Naveen here from UPSC Medico. So as we are done with the mains 2025 UPSC examinations, and as you have all been waiting for the analysis of medical science optional paper, so here is a detailed analysis video. Overall, when I interacted with 100 plus aspirants who have attended medical science optional with UPSC Medico, many of them are in opinion that the difficulty level is on a moderate level, but because they were able to orient their preparation in an exam specific fashion. That means as we move along for the past couple of years, not only optional exams, even the mains, GS mains, general study examinations as well, there is an increase in level of difficulty because the examiner is now getting into the depth of these subjects. He is asking core concepts. So it is not that easy. But even on these difficult days, medical science is still can win you your bread and butter because 80% of the questions are repeats. There is 20% unasked version. And for the couple of years, I am doing this that there was a major shift in focus from not only a PYQ centric approach, we're also doing unasked version approach, as many of you know who are part of UPSC Medical. So we were able to strike 94% of the questions from the paper, right? So after analyzing these questions, I have edited our focus guide, which is a free document with UPSC Medico, which contains all the MCQs starting from all the PYQs starting from 1994 onwards. It's segregated in a subject wise, topic wise fashion. So we will be releasing new focus guide 6.0 with updated questions up to date from 2025 year. So I'll be posting a link in the description of this video. You can download it from there. And for all the course students of UPSC Medico, you will get new handouts of all the updated topics, and also future predicted topics will be released in a notes format, and the relevant videos will be added to the course curriculum in due course. And we will be releasing the 2025 model answers as well in a question and answer format along with the video discussion part. So this will follow after the analysis. You will be receiving all this through the course curriculum. Now, coming back to analysis in general, as I said, 20% of the times they're asking unasked questions, that too in the mandatory part, that is compulsory question number 1 and 5. There is a list of unasked version which I released. It's there in the website of UPSC Medico as well. I have shared this list with all the exam going students. They did prepare all these topics. Among them, they were able to ask this laparoscopic question, cleft lip and cleft palate part from the surgery. And yes, antiparasitic drug. They did ask about neurocysticercosis. And yes, there is a question on tissue repair, which is easy. But again, in CMS exam, Combined Medical Service exam, they ask frequent questions, the factors which impair tissue repair or healing. And there was one question which was again a surprise for many, that is mechanism of action of hormones. They did cover it. See, if you're watching this video to predict 2026 paper, let me tell you, out of these topics, you are going to expect at least 4 or 5 questions. So if you're starting your preparation, if you're part of my UPSC Medico, I have recorded videos for all these topics as well. But there is, if the examiner wants to challenge you from the unasked version, so these are the remaining topics which he can ask. Now, when I say remaining topics, are they not going to repeat immediate questions? They are repeating. There are a lot of questions which got repeated from 2024 in the 2025 exam. There are a lot of questions which repeated from 2019 to 2024, but they went up to 2011, and there were some questions coming in 2019, 99 as well. Okay, so though the horizon is big, now, with the analysis of the paper, I understood that you can't just go for just 5 year of questions. Okay, you need some extra stuff, right? So I could see a lot of questions came from 2019. So 2019 to 2024 is the usual number of things, like people usually stop at 2020 to 2024, that is 21, 22, 23, 24. So this will amount to 5 years, but a lot of questions came from 2019. That means examiner is thinking that usually students will prepare last 5 years of questions, so a lot of questions came from the sixth year, that is 2019. right? So that to be on the safer side, it is important to go for last 10 years of questions, if not everything. So the whole UPSC medical course, medical science, is built on the PYQ starting from 1994. So we would be covering all these things in a topic wise fashion. That's why many of the students who message me, who are happy after the exam, are video course students, because in the video course and notes we covered everything. And there were many students who give me a feedback that everything is from the notes. So that like that makes me happy, because our team worked very hard in compiling and also understanding the question pattern, predicting, recording the videos, putting up in the notes. I think that's how you can double guess the questions and make sure that you feel comfortable on the day of the exam, right? So these are the unasked other topics which you need to be ready if you are preparing for 2026. Sorry. Now, next thing is, as I said, we were able to cover many, like, so, but overall, 80% of the questions were repeats. We will do an individual question analysis. If you have a difference of opinion, I will answer that with the help of showing you questions in the subsequent part of the video. But what I'm trying to tell is 80% of the times it is PYQs. Now, this is common thing. Lot of questions come from PYQs. See, this exam is for 500 marks, but they will give you 800 marks of questions, right? 800 marks of questions. That means they will give you 16 questions overall. Okay, they will give you 16 questions overall. Out of them, you need to answer 10 questions. You need to answer 10 questions, and each question is for 50 marks, right? Each question is for 50 marks. So there is a choice. But problem here is question number 1 and 5 and question number 1 and 5 in each section are mandatory. So this mandatory question part contains a lot of unasked version. So it is important for us to focus on unasked version as well. And this unasked and predictive questions are major pillars of my test series and major pillars of DAW program which we usually conduct. So I take a privilege to ask anything which is challenging, new, unasked, predictive, gray zone question with the help of this test series. So my courses, both foundation and combo course, they comes with video course plus notes, which will majorly focus on 80% of the syllabus, which comes with test series, which focuses on 20%. Now, if not test series, there is an add-on which makes like DAWP daily answer writing program. In the test series, no matter how much freedom I have as an examiner, I can't stretch you or challenge you to the core, because test series is designed not only to give you the 20% extra, but also to make you practice or be ready for the exam with the help of time management, space management, etc. Right? But DAWP, I have full freedom. Daily answer writing program, what I'm doing is I'm challenging students to the core so that they're very happy. For example, last year ranked 35 and 40. Shreya Garg and also Iram, they are part of the regular courses, but what helped them more is the daily answer writing program as well, because they were able to get that extra 10-20 marks with the help of unasked version, which is the major pillar for daily answer writing program. So there are three courses what we offer. We have video plus notes plus test series, which includes combo course or foundation course. Foundation course covers everything, 100% of the syllabus. Combo course will cover 95% of the high yield topics and important ones. But add-on is a daily answer writing program wherein I have privilege to challenge you to the core. If you are serious about this exam, if you have understood that this is not gonna be easy in the future if you just go with a 5 year or a 10 year PYQ or any pirated non-copyright notes from online and thinking that that's gonna help you, so then you're committing a very grave mistake. If you want full-fledged help, this is the way to go. You have to watch the videos and notes which will give you 80%, then you have to do the test series which will give you 20%. So both are essential components of your learning, right? If you do preparation on your own like a semi preparation, then if you just want to test with a test series, then also you'll end up losing 20-30 marks, because you're not getting that extra mileage which a combo course student or a video course student will get. Okay, I'm not creating a FOMO, I'm only telling that if you want guidance, get 100% guidance. If you want to perform, do 100% perform. There is no ifs and buts, there is no shortcuts for success. You should know everything to be able to crack UPSC, because now UPSC exam is not just based on PYQs or repeat of last 5 years of papers. They are testing you to the core because the competition is very high. Competition is very high. And out of 20% unasked version, we were able to predict approximately 14% of the questions. So that's a big chunk of number. I'll show you what are all the questions we were able to predict. Now, this questions in the board are the ones which I tried to cover in the regular course, test series, and daily answer writing program, predicting that it might come. For example, about the medical legal aspects of contusion, I covered it in the revision batch because in 1996, I guess, they asked a question on age of a bruit. How is it gonna help? See, the contusion itself is a bruit. Contusion itself is a bruit. Okay, so based on the color of the bruit, you can predict the time of uh, injury, right? So this is one question we covered. And drowning and diatom, it is well covered in the notes, videos, and also in the test series. I think there is not even a single exam for the past couple of years wherein I didn't ask a question on drowning, right? So if you're part of UPSC Medico, you'll know. Along with that, if you open my microbiology lectures and see, polio is eliminated in India in 2014. But why are we learning polio? Polio, they will never ask you what is the clinical features, what is the epidemiology, what is the lab diagnosis of polio, because there's no cases. Polio, they will majorly focus on elimination. What is India doing to maintain the polio status? Elimination is a favorite question in any of the test series of UPSC Medico. In a similar way, if you watch my microbiology lectures, there's a lot of PSM based discussion differentiating OPV from IPV, why vaccine derived poliovirus vaccine is more common with OPV, why it is important to switch OPV, and why it is important to introduce inactivated poliovirus IPV injections in the country. All these are the answer for challenges of this VDPV. And very recently in 2024, there is a case in Meghalaya, vaccine derived polio. Even in 2025, it is underreported, but we could see polio kind of symptoms coming up. So here comes AFP surveillance that you should focus. Okay, acute flaccid paralysis surveillance. Now, this is one question we were covering. Similarly, pyelonephritis as a topic is covered in general medicine, but medical imaging, what are the various imaging modalities in the diagnostic evaluation of cardiac illness is asked. So I thought that they're going to ask, instead of cardiac illness, respiratory illness we covered. Okay, acute breathlessness we covered. So we were predicting the pattern that they're going to ask you the role of imaging modalities in a disease within the syllabus. So in general medicine, they took pyelonephritis, wherein we did cover in detail about the diagnosis of pyelonephritis in the regular video. And this is again fun. So this was, I felt very happy. They asked a question on ALL. So ALL versus AML, and how is ALL treated? Go to pathology section, go to general medicine. I have uploaded new video last year because all the 24 years they were only asking question on AML, M3 and CML. Suddenly last year in 2024 in pathology, there was a sudden question on ALL, CLL part. That means instead of asking myeloid leukemias, they started asking lymphoid leukemia, because leukemia is part of the syllabus both in pathology and general medicine. So they asked a question in pathology. So instead of just stopping at clinical features or morphology, I also discussed the treatment part in general medicine as well this year. There is a detailed 1 hour video, and it has been added to the latest edition notes as well. So people who are part of UPSC Medico video course, they were able to answer this tricky question which came for 25 marks. 25 marks. Right? So I was able to help students with 25 marks because I was able to predict that this year they asked it in pathology only, morphology part. They might ask about the treatment. So we went into an extent of discussing treatment for ALL, CLL as well. Right? So it's added in the notes. The treatment has been discussed. Right? I felt very happy that we were able to predict 25 marks. And there was a beautiful image, myeloblast versus lymphoblast, the difference, the hand drawn image I just explained. And I covered this video, hand drawn image discussion, even in the revision batch as well. And now, next, renovascular hypertension. So one topic, one unasked topic which was covered as a part of general medicine is renovascular hypertension. They used to ask secondary hypertension causes, and one of the important secondary hypertension causes is renovascular hypertension. Right? So the same question I covered it in all the DAWPs, renovascular hypertension. Right? And also adverse events following immunization is part of a DAWP program, and anal fissure. So this is covered beautifully in the regular courses. I told you that when you open general surgery, there are gray zone topics. In the gray zone, the diseases of anus and anal canal and rectum, diseases of rectum, and diseases of gallbladder and bile duct. So every year, one different question. For example, there was a question on Mirizi syndrome. There was a question on extrahepatic biliary atresia. There was a question on fistula in ano in 2023, I guess. So we have predicted that, and we have recorded a 3-hour video on these gray zone topics in the regular course, wherein I covered fissure in ano, I covered hemorrhoids, I covered solitary rectal ulcer syndrome. So a lot of new topics also we covered. So this is one area, the gray zone area, diseases of anus and anal canal and rectum, diseases of the gallbladder and bile ducts. They're not going to repeat the same topic. Instead, there are many sub diseases within this topic which examiner is going to focus. Okay, so we were able to cover. And cleft lip, cleft palate, the principles of management has always been part of the various test series, and I have discussed very detailed cleft lip palate repairs in the regular course as well. So these are all the questions we were able to predict. So the questions we are unable to predict are these. That is, what is Morton's metatarsalgia? There was a question on the palm and sole, supply of the palm and sole, which we were able to cover because in the anatomy syllabus, upper limb nerve supply is important, lower limb blood supply is important. But in lower limb nerve supply, sciatic nerve is the nerve which we covered. Along with that, the dermatomal distribution of the lower limb is a famous question. So within the dermatomal distribution, lot of times we were able to divide the tibial S1, S2, S3, right? So these dermatomal distribution, with the help of that, you can answer 5 marks of the question. But the other 5 marks is Morton's metatarsalgia, which is a little difficult. The terminology can give you an idea, but at the end of the day, it goes into the unasked version, which we are unable to cover. Similarly, regulation of BP. Within the BP, okay, blood pressure is regulated by cardiac output into systemic vascular resistance, right? So how is the systemic vascular resistance regulated is the question, okay, which is for 5 marks. Similarly, what is the second messenger mechanism that mediates downstream action of hormones? This is also we didn't cover. We were only focusing on the pituitary gland and its hormones, mainly the posterior pituitary and also little bit of growth hormone. But how these hormones act, the secondary mechanisms, the cyclic AMP, the cyclic GMP pathways, IP3, DAG pathway. If you are parallelly preparing for NEET PG or INACT exam, you know how important these receptor transducer mechanisms, G protein coupled receptor mechanisms, every time there would be a question on this in the MCQ based exam. But here we are unable to cover because I thought mechanism of action of hormones, synthesis, etc., as part of the syllabus of endocrinology of physiology, but I never thought that they're going to ask a generic question on that. So mistake is on my part. So because they have asked in general, next time they will ask you specifically, discuss about the tyrosine kinase pathway. So I will keep these points in mind. So when I prepare new papers, new content, new videos, new handouts, I will try to extrapolate so that we can better predict the examiner mindset for 2026 attempt. Okay, so that is my expertise, our zone wherein I am helping these students so that they feel as close to as familiar as in the final day of the exam, right? So that is very important. Now, apart from that, the next part of the question is, here a lot of students got confused. 12-year-old child, fever, multiple crops of vesicular rash, spreading towards the trunk, mention the mode of transmission and spread of probable viral agents. So last year only they asked a question. What are all the herpes viruses we have? In the herpes viruses family, you have herpes simplex virus 1 and 2. Apart from that, there is herpes zoster virus which causes chicken pox. So this is a classical picture of chicken pox. I thought that they're going to ask herpes questions, so that's the reason in test series I have included a question, same clinical question, but not on herpes zoster virus. I thought they will ask a genital ulcer question, so we went into the differential diagnosis of genital ulcer, how to treat HSV genital ulcer, what is the lab diagnosis. But yes, so because they asked HSV chickenpox, they can even ask varicella next. Okay, the herpes zoster, which is a dermatomal distribution rash. So anything related to herpes viruses family, we have almost 1 to 7, right? So any virus is in the radar of the examiner. So herpes is not just herpes simplex. Herpes viruses is a whole family which is part of the syllabus, right? So that is the biggest learning for 2026 exam going students. Now, describe the legal duties of a medical practitioner in case of a suspected poisoning. You might have seen that this year forensic medicine test papers are very tricky and I made them very tough. I was asking you the forensic medicine duty in case of examination of the victim of sexual assault and also accused in the sexual assault. Role of a forensic medicine specialist in disasters like air crash injuries or airplane injuries, because there is a recent Ahmedabad plane crash incident, right? So I asked a question on that. I also asked a question on forensic medicine expert in genomic fingerprinting, gene fingerprinting. What is their role? I also asked a question on bomb blast injury, forensic medicine expert. I also asked a question on role of forensic medicine expert in the examination of the death of drug of abuse. And I also asked a question on forensic medicine expert duty in examining a case of hanging. So I was able to see. I know that they are going to ask the forensic medicine expert advice or what is the role of this forensic medicine, but I couldn't predict that they go to such an extent of asking the same question in toxicology as well, because most of the times in toxicology is a gray zone topic. We don't know out of 20 30 toxins what they can ask. This year they didn't ask any poison, but rather they asked classify the poisons and what is the role of forensic medicine expert there. You need to know a lot of sections here. I think this is a trickiest question one can get. But one thing is clear. If you are reading forensic medicine, you have to read it like a forensic medicine expert, not like a medical practitioner. The role of forensic medicine expert is different from, it is completely different from the role of a medical practitioner. Both have a different approach. And you need to highlight that. You need to give a lot of medical legal significances and you need to write a lot of legal sections. Okay. Now you can't write IPC or CRPC, right? You have to now write BNS or BNSS. Okay, so this is a challenging situation again. So in the regular course, I have uploaded a new video on what are all the changes you see in BNS and IPEC sections. You should be aware of that, right? So there was a question on treatment of pelvic endometriosis. This is also tricky. See, last year they asked a question on chronic pelvic pain. So, chronic pelvic pain, the major cause is pelvic endometriosis. So, pelvic pain is there as a topic. I thought because they asked chronic pelvic pain, I started asking the causes of acute pelvic pain in the exam, thinking that examiner will ask acute pelvic pain. I have recorded that video and I updated that in the notes as well, latest notes. But somehow he opened altogether a new channel, that is pelvic endometriosis. Now, any cause of pelvic pain can be a question in the exam. And you know, right, pelvic endometriosis is becoming so frequent, it is the major cause of infertility. But it is mistake on my part that I didn't teach you endometriosis because we were focusing more on PCOD, STD, infections, chronic pelvic inflammatory disease, acute pelvic inflammatory disease. We did discuss all these things, but endometriosis is one topic which we didn't touch because we have fibroid, prolapse, etc., which are major topics. But suddenly you asked a pelvic endometriosis for 10 marks, then if you know a little bit about pelvic pain and its causes, from there you can write at least 2 to 3 marks of answer, but it is a tough one. Now discuss WHO medical eligibility criteria for contraceptive use for women with medical conditions. So it's a usual eligibility criteria given in data, but we didn't discuss that because contraceptives we always focus on OC pills, IUDs, and what is there. I did ask a similar question in test series on the guidelines, like the ideal contraceptive, what is an ideal contraceptive, who is an ideal person for IUD wearer. So these kind of questions I was predicting, but this is altogether different. The next question from NRHM is Kilkari initiative. 2 years back, they asked the question on MCTC, Mother and Child Tracking System. So this is also a technical thing. Kilkari is also technical, but it is audio messages. Automated audio messages are sent to enrich pregnant women and children. It's health education tool. Kilkari initiative. Kilkari and MCTC, they are like, this is only audio message. This is tracking system. MCTC, they asked 2 years back. Now they suddenly asked Kilkari. So now what we need to do is we have to predict any e-program, any online program, or any technical advancement in the health as per NRHM is important. Okay, any NRHM new technology or e-mitra, vaccine mitra, so anything like any national rural health mission program is important. They're asking specifically from the table or the text given from park, right? So we were able to cover everything except Kilkari, because Kilkari was given last, and I don't know, 10 mark answer for a Kilkari is like asking too much from us, right? So this is Kilkari initiative. Now, which are the parameters employed for maintaining epidemiological surveillance over malaria? This is also tricky, but if you are preparing for normal NEET PG exam, you know, annual parasite index, slide positivity rate. There are some parameters which are used in surveillance of malaria. Those are important, right? Now, see, in this, there are two things that are important. Now, these are from the mandatory section, 5.E, 5.A, and 5.D. So though the weightage is low, they're gonna cost us, because you are losing straight away 20, 30, 35 marks. So you're not writing exam for 800, rather you're writing exam for 765, but still 35 is okay, right? Because we were able to predict a lot of these things. See, 1A, 1B. So mandatory section. So what does it teach us? You have to learn not only the PYQs, but also you have to be ready in a predictive fashion, which is the core pillar of content we create. Okay, we sit together and we try to predict and analyze as close as to the exam. So that's why now we have a strike rate of 94%. We started with a strike rate of 85%. So now we were able to up it by 94%. If I'm able to cover 100% with the various courses, because I can't do it in a single one. So we offer video course, we offer notes, we offer test series, we offer daily answer writing program, we also offer revision program. So with all these things, we were able to reach to that 100% core. Okay, right. So 6% we are unable to cover, but we will take it as a challenge with a with better analysis of the current paper. We will try to even touch that mark. And for any future 2026 student, it is important to deep dive into the previous year paper to predict the analysis or to predict the future paper. Okay, so let's quickly jump into the each individual question from each topic or from each subject. Now, when I talk about anatomy, the weightage is 70 marks. Clinical STEM questions were given a lot, 100% within the syllabus. There is one unasked question, that is taste pathway, which is a little tricky. And overall 30 marks were unasked, but taste pathway is different. But we were able to predict that in the regular examinations. In test series, there was a question on taste pathway, pain pathway, optic pathway, auditory pathway, because in the syllabus it is clearly given pathways of cutaneous sensation, vision and hearing is part of the syllabus. So from that they have asked taste pathway. Even the tongue is part of our syllabus, so they're asking questions even from tongue. So starting from, so we all know there are three nerves: radial nerve, ulnar nerve, median nerve. One nerve will definitely come. Even in the revision batches also, in the last minute we were able to revise that. So ulnar nerve formation, course and branches, which muscles they supply, and why it is called musicians nerve. So we were also predicting one more exam in the future, median nerve, why it is called laborers now, what branches does it supply, what is the formation course. Next year median now can be a expected question. And as I said, peripheral nerves like ulnar nerve, median nerve, radial nerve are a frequent repeats in the exam. They are pretty frequently repeated. Now, name the nerves and the branches that supply the soul of the food. Soul of the food supply, dermatomal distribution is well covered in the regular course. And also, what is this Morton's metatarsalgia is one area where we were unable to cover. Morton's metatarsalgia, you will feel pain between the third and fourth toes because of a neuroma, degeneration of the digital plantar nerve. So that leads to pain in the forefoot, mainly localized to the space between the third and fourth toe because of the swelling or neuroma formation of the interdigital nerve because of the degeneration. This is Morton's metatarsalgia, but I think it is very tough for a medical science optional student to write that, so you can leave it. Now, using a well labeled diagram, so this part is important. You have to draw the diagrams. Okay, if you're preparing for 2026, the first thing that you need to do is at least draw 1 to 2 diagrams a day. Okay, we have done an elaborative diagram practice in the recent revision batch for 2025 as well. So wherever there is a need for diagram, you have to draw, even though there is an it is not asked in the question also, you have to draw the diagram. Now, taste pathway, touch, pressure, vibration from dorsal column, medial lemniscus pathway, pain, temperature from spinothalamic pathway, optic pathway, auditory pathway, optic pathway. All these pathways are important. Okay, pain pathway, taste pathway, hearing pathway, vision pathway, accommodation pathway, which is asked in the regular test series, dorsal column medial lemniscus pathway, spinothalamic pathway. All the sensory pathways are important for this exam point of view. Taste pathway has been asked, and we know tongue is an important aspect. The taste receptors of tongue has been asked multiple times in the exam. Right? Now, a 36-year-old. Next question. I'm dealing with anatomy now. We're done with the two questions. Taste pathway was difficult. The remaining two questions were covered in bits and pieces. Alna now is the most predictable question you can get. Now, coming back to the next question. 36-year-old cyclist suffered pelvic injury while riding into a pothole. So this question reminded me of a regular NEET PG exam. There won't be any NEET PG or CMS exam per se also. Last year in CMS also they asked this question. Lot of questions came from CMS exam. So that's why based on CMS 2024 paper, I have dedicated a full GT grand test. That is, if you're part of Target 2025 test series, you will know that GT3, that is full length test 3, contains all the predictive questions from CMS, and from there 6 questions came directly in the exam. So wherever I see that question, I'll highlight that this came from CMS exam. So this is one question, that is rupture of the bulbar urethra. But problem is urethra is not part of the syllabus, but they are considering urethra as a part of perineum because perineum is part of anatomy syllabus, and they have asked what is superficial perineal pouch and deep perineal pouch, what are the contents in the past. Now instead of just asking perineum, they're also asking perineal injury. The applied aspect of perineal injury is that along with the perineum, because urethra is part of that, the urethra gets injured. They're asking you what are the parts of principal structure involved. Urethra is involved. So urethra has bulbous urethra, membranous urethra. So here it is the rupture of the bulbous urethra. Apart from that, they're asking you help of a labeled diagram. See, in anatomy, sorry, 2 to 3 questions, they're asking you to draw the diagram. Okay, so it is very important to practice images. When they're asking you to draw a flow chart, you have to draw. When they're asking you to write in a point-wise fashion, you have to write in a point-wise fashion. When they're asking you to draw the diagram, you have to draw the diagram. When they're asking you to tabulate, you have to put a table. When they're asking you to differentiate, your answer should be in a tabular form, differentiating both of these things. So you have to answer as per the demand, which is like I was stressing upon this point throughout the guidance period, right? Throughout my discussion, throughout my test series evaluation. It's very important to answer as per the demand. And superficial perineal pouch in males and females, they're asking you to differentiate. Similar question in 2004. Boundaries contents of. So because it's been a while, they haven't asked a question on perineum, they repeated it. And perineum as a topic is well covered in the exam. And lot of questions I have asked which were not frequent repeats or a recent repeats. We went up to 1994 as well. There are some questions. Yeah. Now, a 55-year-old lady visits surgery OPD with 3 months old history of painless heart swelling. So they're giving you a clinical case of CA breast and they're asking you what is the importance of the sentinel lymph node biopsy. Just for 5 marks, they're making you read 4 line big clinical stemmed question. But in 2020, the same question has asked what is the role of sentinel lymph node mapping in the breast surgery? Right? Now, next, there was a question a 45-year-old man, orthopedic OPD, knee joint. So, any joint like knee, shoulder, or hip, there would be one question. And as I well predicted in the recent analysis and revision batch as well, they're not asking you the core questions from knee, shoulder, hip. That means they're not asking you what is the movements, muscles, relations. They're mainly asking you applied anatomy and they're getting into the depth of applied anatomy. Like, for example, knee joint, always and always in every lecture of my knee joint, I'll tell you the ligaments are the most important thing. And in the ligaments, we have an unhappy triad, among which there is an injury to the medial collateral ligament, medial meniscus, and also ACL. Because there is an anterior joint instability in this particular question, along with swelling in the knee, decreased movements of the knee, tenderness of the knee joint. Anterior joint instability is pointing towards ACL ligament injury. So you can mention about ACL ligament injury. Along with that, you can talk about unhappy triad for this particular question. And you have to highlight all the ligaments, mainly tibial collateral ligament, fibular collateral ligament, medial meniscus and lateral meniscus, anterior cruciate ligament and posterior cruciate ligament. All these ligaments you have to highlight as a part of this question. So any joint, there is no exam, no anatomy paper without a question on joints and peripheral nerves. That means they will ask a question on shoulder joint, hip joint, and knee joint, and they'll ask a question on radial nerve, ulnar nerve, and median nerve. This itself is a 30 marks out of 70. So now, if someone is starting fresh, you don't have to read the whole BD Chaurashya 3 volumes. You can be very picky with anatomy. Like 10, 15 topics, they'll ask the same questions again and again. Okay, this is where I'm helping my students to lessen the burden and to give them the crisp and concise content in a revisable fashion and also in a predictive fashion. I think I can add that to my crown as well, that I was able to predict a lot of questions for the future students. So here comes UPSC Medico with all these special features. Now the next, I think we're done with the anatomy. Let's quickly jump into the biochemistry. Biochemistry, there is a 65 marks and almost easiest subject among all, almost 55 questions from PYQs. But good, there was one thing that they haven't asked any question from protein synthesis this time. Now let's get into the individual questions. Anatomy, organ function test, classification of the jaundice. Every year they'll ask the same question. Now, uh, organ function test, they're asking a lot of questions on thyroid, liver, and renal. Every year they'll ask only one organ. This time they covered all the three. You are lucky if you have revised the organ function test. And for the revision batch, I have uploaded 1 hour detailed video on organ function test. They were able to touch 30 marks with the help of just revising organ function test. Now, within that, the problem here is we were expecting renal function test last year only because they haven't asked any question on kidney part for long. They suddenly in 2025 they asked about renal clearance. So mainly renal clearance or glomerular filtration rate. We are looking at the functions of glomerulus. Kidney has both glomerulus and tubules. Now glomerular function can be detected by GFR estimation or blood urea or serum creatine or clearance. So all these topics are important. So we always learn renal function test keeping in mind these topics. But suddenly this time around, there was this tubular function test. Specifically, they're asking you how to assess renal tubular functions. So there were urine concentration test or water deprivation test, which we do for diagnosing diabetes insipidus. Or you can go for urine dilution test, or you can go for urine acidification test. So this is covered in notes, but we didn't cover these for 10 marks. Not in detail. I just gave you the names, but place when I was discussing urine examination, I told you the importance of Specific gravity. Specific gravity is one parameter based on which, or urine osmolality is one parameter based on which you can identify or you can find out whether the tubular function is good or not. So these are my 5 tests which are used in assessment of the renal tubular function. A little tricky question, but I think many of the students, instead of assessing it as a tubular function, they might have given only the 5 different functions like GFR, acidification, etc. Okay. So you might lose a mark if you don't focus on the specifics of the question. Right? So the next question is, explain the role of biotin. So vitamins and minerals, gray zone area, they can ask anything. This time they asked a question on vitamin biotin or B7. Okay. There was one previous question, avidin, egg protein, has they discussed the biochemical role of that vitamin. So avidin binds to vitamin and makes it non-available. So that's why people who eat raw eggs, they show biotin deficiency. Now they're asking you similar question. Add a note on mechanism of action of any biotin antagonist. So it's like it's acting like an antagonist, avidin, by binding it to it. So you can mention avidin. Apart from that, there are other antagonists which are mentioned in the book. That is desthiobiotin and biotin sulfonic acid. So to that extent, it is okay. Its applications in medicine is tricky. Like there are some various applications, but we can't predict them in detail. So instead of that, if you can answer biotin with all the reactions that it catalyzes and it's what is avidin and how it is important, if you can just mention that, it's well and good. The applications I will include it in the regular discussion, that is PYP discussion. And because they're asking you antagonist of vitamin, previously they asked the vitamins of vitamin A. Now, for all the vitamins in the next future, when we do revision, we will try to include all the vitamin antagonists as well. Okay, a separate table I will release and I'll put it in the notes as a handout. Okay, so we are not only analyzing individual question and we are also trying to predict what can be asked in the future, and we are also adding a lot of new content to the existing notes will be released as a separate handout. Now the next question is selenium, simple antioxidant. So sources, role, deficiency, manifestations. So the one mineral is selenium they asked. One vitamin is biotin. So similarly, these questions got repeated. In 2019, they asked a question on selenium. Now RFF, I told you in biochemistry, tools of biochemistry, they can ask anything. So they picked RFLP, which I already predicted. So what are the applications? And among them, at least mention 3 is the question. And second thing also, they asked a question on radioimmunoassay, but very beautifully they integrated this question of radioimmunoassay with thyroid function test, because any hormone in the body is present in micro levels like picogram or nanogram level. So we need a sensitive tool to be able to assay these hormones which are present in tiny quantities. So here comes radioimmunoassay, which is actually used for assessment of thyroid function test. Okay, so that's why outline its role in diagnosis of thyroid disorders is one area where you have to write thyroid function test. You have to mention the thyroid function test values of free T3, free T4, TSH, and based on that, you can say what is hyperthyroidism and what is hypothyroidism. So you will answer end there. Apart from that, they're also asking you the advantages and disadvantages of this technique, which is again a question from 2017, which is repeating. Now, enumerate hematopoietic vitamins. There were a lot of general based vitamin questions. Like they'll ask you, what are the sulfur containing vitamins? They will ask you, what are the vitamins which decrease in amount when OC pills are taken constantly, or anti-epileptics when they're taken concurrently? Which of the following is a vitamin which has? So they, instead of directly mentioning the name of the instead of directly mentioning the name of the vitamin, they can go to such an extent of asking just mention about the different vitamins and how they are uh, what is their biochemical basis. So hematopoietic, we all know the folic acid and vitamin B12 are the 2 things which you should definitely mention, because those are the vitamins which are commonly used for production. Apart from that, vitamin B6 pyridoxine, vitamin B2 riboflavin, and vitamin C. Vitamin B2 and vitamin C are important. Vitamin B2 and vitamin C are important for the purpose of iron absorption. Okay, for the purpose of iron absorption. Then, so these are the vitamins, and they're asking you biochemical basis of deficiency manifestations of any two. That means any two you have to choose folic and vitamin B12. Similar questions came like in 2020, 95 and 2003 also. They're asking you what are the different types of vitamin deficiency anemias. What is the role of vitamins in prevention of megaloblastic anemia? So they were always focusing on this folic acid and vitamin B12, right? Chalo. Then apart from that, hmm, I think we're done with the biochemistry. Let's do physiology in detail. Physiology again predictive. There were questions on the process of generation and conduction of nerve impulses in humans, and what is the saltatory conduction. So there were a question in 1998, but all the synapse related questions, the saltatory conduction part, how impulse is generated, action potential, how is transferred. I already discussed all these things in the regular course. So we were expecting a question on nerve conduction, and after 1998, they were asking a similar question again. Okay, which we were able to cover in the regular course. Now, with the help of a suitable diagram, explain the innervation and function of muscle spindle. See, muscle spindle, Golgi tendon organ, stretch reflex, inverse stretch reflex was always there in our cards, right? Even in 2022, they asked a question on diagram of stretch reflex. Instead of that, they are now asking you mainly to draw the diagram of muscle spindle in detail. Like you have extrafusal fibers, intrafusal fibers, one alpha, one beta. So the diagram is part of our notes. Similarly, Golgi tendon organ diagram is also there. How they help in reflex, we already did in the regular course. Now, cardiac output, regulation, cardiac index, cardiac reserve. I think I don't have to tell much about these things because they are very important topics. Now, this is little tricky, right? As I already told you, this is uncovered. Regulation of BP is always in cord, but in regulation of BP, we are focusing mainly on the barrel reflex and also renin-angiotensin aldosterone system. We were not focusing much on the peripheral resistance part. We all know resistance, if there is a blood is flowing from the heart, resistance depends upon the length. The longer the length, more is the resistance. Resistance depends upon the viscosity. More is the thickness of the blood, more is the resistance. Resistance also depends mainly on the diameter of the blood vessel. That means if there is a vasodilation, BP will come down. That's why we give vasodilators to check BP. If there is a vasoconstriction, the BP will increase. Right? So this area they are asking you what is vascular resistance, what are its determinants, and what is the role of its determinants. We call it as a Poiseuille's equation. So we haven't covered in the regular course, so my mistake. But again, if you go and check Shambulingam, if you go and check Gannon, Gaitan, nowhere else they give this systemic vascular resistance part as a separate thing. Even I don't know from where the examiner got an idea to ask this question. There are good questions like baroreflex you can ask, chemoreflex you can ask, right? But systemic vascular resistance is a new stuff. Right. Next question is help of suitable examples. Explain secondary mechanisms. See, there is a syllabus mechanism of action of hormones, formation, secretion, transport, metabolism, function, and regulation of secretion of pancreas and pituitary gland. I thought that they're asking you mechanism of action of hormones relevant to the pituitary gland and pancreas, but examiner understood it differently. He's asking you in general what is the mechanism of hormones. So hormones as an individual topic is also important for exam. Maybe in future they might ask you what is an endocrine and an exocrine hormone or an autocrine, paracrine or an ecrine way of release of hormones. So we have to be ready with the basics of the hormones as well for future. So there are secondary mechanisms like cyclic AMP, cyclic GMP, IP3DAG, tyrosine kinase pathway. Like if you are smart enough, you can write the mechanism which is asked for insulin because insulin we did cover in the pharmacology. Tyrosine kinase pathway is used in insulin mechanism. You can use it if you need it. if you feel like writing something. And even for metformin also we covered cyclic AMP way of communication. So if you can apply some common sense and write it there, at least a couple of things, it will fetch you good marks. Now give a brief account of synthesis, storage, secretion, function. So I told you one hormone you can have to prepare is growth hormone. Other is posterior pituitary hormones like vasopressin and oxytocin. So these two are important, and lot of times in multiple years posterior pituitary hormone questions got repeated. Now you have a syllabus in microbiology, that is cell mediated immunity and humoral immunity. Now there is a also hematology part of the physiology wherein they'll ask RBC, they'll ask platelets. Now last year onwards, 2024, they started asking WBC. They started with eosinophils. Now they're asking lymphocytes. So in future, they might ask a basophil, okay, or a neutrophil. So whatever it is. So any cell can be a potential question. They're asking you what is cell-mediated immunity, what are the cell types which are involved, and what is the process of phagocytosis. Now, thrombocytes or platelets, how they form and how they function, or thrombopoiesis, a detailed discussion is already there in the book. Even in 2009, 18, 2024, 2001, the similar questions came in the topic called platelets. Now, next, pathology weightage is for 60 marks and most easy and predictable because they asked a question on lung carcinoma, CS cervix, CML M3, MI, nephrotic syndrome, that is post-infectious glomerulonephritis, and tissue factor, tissue repair. All straightforward questions, all are repeats. And this 2015 and 20 they got repeated, and again in 2025. And each of the every test series and DAWP I conducted, I included bronchogenic carcinoma because I thought that it's gonna get repeated. Similarly, cervical intraepithelial neoplasia. This is not final CS cervix. We learned a lot about CS cervix, but in the regular discussion, I did discuss about CAN as well. There is a separate video in pathology section on carcinoma, cervical intraepithelial neoplasia. So they're asking you that, and we have discussed in detail this E6 and E7 mechanism of HPV. So this video is also there in the YouTube of UPSC Medico. So they asked this question for 10 marks, which is a frequent repeat. And CML, we all know CML, chronic phase, the lab diagnosis part, which is a frequent repeat. And MI, what happens with gross and light microscopic changes? What are the cardiac biomarkers? Very easy and important question. And as I said, there won't be any exam without a question on gray zone topic called glomerulonephritis. So in a similar way, they have asked question, but look at the headings. As I said, pathogenesis, light microscopy, immunofluorescence, electron microscopy. The problem with glomerulonephritis, you need to know the differentiation between various microscopic findings. In minimal change, this is if I ask you about a normal microscopic or light microscopic changes, nothing is seen. But in electron microscopy, you will see effacement of the food processes. So when you're writing answers from the glomerulonephritis topics, it is very important to be able to differentiate that. Right? So a lot of times in 2006, 11 and 19, the similar acute post-infectious glomerulonephritis or acute post-infectious glomerulonephritis is one, post-streptococcal glomerulonephritis is the other thing, which is a very important question, which leads to nephrotic syndrome, cola-colored urine. Now, healing by first intention and second intention with the help of images I explained in the regular course. Factors that influence tissue repair are many, and it is a frequent question in CMS. Last year also it got repeated. Right. Next is pharmacology. Very easy for 45 marks. This time around, they didn't play much with pharmacology. Last time pharmacology was a headache, but there are some areas wherein you have to be very careful. For example, they didn't ask about classification of antifungal drugs, which we did discuss in detail. They're specifically asking you topical ones and their indications. If you practice medicine, a lot of times fungal infection cases come to us, tinea crura, right? Mm, usually ringworm patients, so like tinea, we give for any dermatophytosis, we give them clotrimazole cream, right? Clotrimazole plus with some steroid to reduce the itching. This is one drug which you can mention. Even ketoconazole topical can be applied. I'm talking about topical antifungal, and there are ketoconazole shampoos for dandruff and all. And even nystatin can be applied to the oral lesions as well. So they're asking you the different topical antifungal drugs, their indications and side effects. So you might know the whole classification of antifungal drugs. It is important to learn classification which is not only structural, the next level is classification based on the route of application or mechanism of action, etc. Also, you need to know. Okay, so the second level of classification is important. Now, anti-helminthic, we were expecting in 2024 itself, they asked about albendazole. If you know that, albendazole is a drug which is used for neurocysticercosis. Along with that, the other drug which is used is praziquantel. So you just need to mention the side effects. If you read 2024 itself, in that, along with the mechanism of action, I also covered the side effects of albendazole. Okay, so that will give you 5 marks. See, I have shown you many of the times 2024 got repeated in 2025 in a slightly different form. So that's why when I record 2025 paper answers now for the regular course, I'll be covering a lot of new things in that video and in that notes. So though the model answer for 2025 looks bulky for you, read it completely and listen to the video completely, because we will do any previous year paper in a predictive fashion, the detailed discussion part. Right? Now explain why beta blockers should not be given to the diabetes patient who are in oral hypoglycemics. Very simple. Beta blockers, they block the sympathetic output. That means they will mask the signs of sympathetic outburst seen in case of hypoglycemia. If there is an hypoglycemia, patient becomes irritable, sweat will come, tachycardia will be there, palpitations will be there. They'll all will be masked by beta blocker or propranolol. So that's the reason beta blockers are not given in diabetic patients when they are concurrently taking oral hypoglycemic agents. Now this question has an issue. This is not explained why folic acid. It should be folic acid should never be given because folic acid is not useful, but folinic acid is given. And this question I got repeated in the regular test series, target 2025 test series, DAWP as well. Because any explain why questions in pharmacology are high yield questions. Okay, we give folinic acid, not folic acid. Folic acid will not work. We have to give folinic acid. Similar question came in 2017. Now, role of nitrates. Nitrates are vasodilators. So, general and cardiac vasodilators is part of the syllabus. Along with antihypertensives, there is another part of the syllabus. That is general and cardiac vasodilators, which we usually ignore, and they are used for angina. So, anti-angina is also part of our syllabus. Okay, we learn antihypertensives, but anti-anginal drugs are also part of the syllabus. So, nitrates are used for the treatment of angina. Now, describe in brief mechanism of action and therapeutic use of exenatide anti-diabetic medication, that is GLP-1 analog. Now, anti-diabetic drugs is a Pandora box. It's a gray zone topic. For example, last year they asked a question on SGLT2 inhibitors. Before that, they asked a question on pioglitazone. So they can ask in future, they can ask a lot of questions on any new class of drug which is coming in the anti-diabetic. So any subclassification from part of anti-diabetics is important for exam point of view. So you have to learn each and every drug, exenatide. Okay. Now, next thing is advantages of artemisinin-based combination therapy in the treatment of malaria. Recent repeat, similar questions has come in 15, 16, 19, 20. We all know in Plasmodium falciparum, we are not using the regular chloroquine because in India there is resistance to that. So we go for ACT combination. Artesunate combination therapy is given to prevent drug resistance, to make drug synergistic. With a less dose, less side effects, more effect will be seen. So ACT combination has got a lot of advantages, which is already covered in the regular discussion. Now, next question is enumerate the drugs used in management of hypertensive crisis. See, hypertensive crisis includes urgency and emergency. You have to write the definitions for that. And in almost all the regular test series, DAWP and the target test series, we did cover about the detailed crisis management. And there is a new video in the regular test series course about the antihypertensive therapy used in hypertensive crisis. Okay, so this is a repeat. In 2009 also the same question came. Now name the drugs, doses, duration of treatment after post-exposure prophylaxis of HIV. Okay, in HIV they are now asking you PEP, post-exposure prophylaxis therapy, the 3 drug regimen that should be given. You have to mention that. Right? So pharmacology is done. Microbiology, 50 marks weightage. All the microorganisms which are expected are included. But microbiology, microbiology also includes, apart from the regular discussion, microbiology also includes cell-mediated and humoral immunity. So in cell-mediated immunity, you need to know about lymphoreticulaire system and B cell maturation. Okay. And there is a make a schematic flow chart. So they're asking you to draw a flow chart for pathogenesis. I think this is the common feedback I give to many students. Next question is on salmonella or typhoid, which causes enteric fever. They're asking you the pathogenesis of typhoid fever and what are the category of drug resistance. See why they're asking drug resistance. Usually drug resistance questions are not part of microbiology, but the same typhoid is also part of general medicine infectious diseases. So we have to learn them in an integrated fashion. Similarly, they'll ask you tricky questions on cryptococcus because cryptococcus or fungal meningitis is again part of general medicine. Unless the question has an integrated approach or unless the question is uh, given in any other subject, they'll not ask detailed questions. If they're asking questions in depth, means you need to understand the syllabus correctly, or in depth you need understanding of the syllabus. So understanding syllabus, solving PYQs, predicting the questions in future, practicing the right test series, revising it correctly, having the right mentor are all essential components of this UPSC preparation. Okay, you cannot ignore one and think that you're going to win the race. Next question is again, there is a probable viral agent. So I was discussing that the varicella or chickenpox, which is part of herpes viruses. Okay, so this is what is the question. This is part of herpes viruses. 12-year-old child, multiple crops of vesicular rash spreading from face to the trunk. So probable viral agent is varicella or chickenpox. Mode of transmission, flowchart of infection in humans, lab diagnosis, post-exposure strategies. All these are part of this question for 10 marks. Now malaria, important. So what are the malarial parasites which are prevalent? The species, and which species is associated with life-threatening complications? We all know. Falciparum has cytoadherence, rosette formation, and it mainly affects premature RBCs and it leads to thrombosis in the microvasculature. So those are the reasons it causes life-threatening complications. And we have vivax, we have falciparum, we have malaria. Okay, so there are different species like this, Plasmodium ovale, but each has different peripheral blood smear feature. And I was always and always predicting, you go and watch my videos, I'll tell always that species identification is an important area where we can expect questions in the future. I was thinking that it might come in 3 years, 4 years, but it took 4 years to ask a simple question. What are the different peripheral blood smear findings seen in different species of malaria parasites? If you are parallelly preparing for NEET PG or INSET, you will know how important it is to know the species identification of malaria. Right? So that is the question. Now, challenges of circulating VDPV, note on environmental surveillance, very in depth, like almost 1.5 hour video on just polio elimination is covered in microbiology. You can kind of write some points from there. So polio, they'll not ask you characteristic epidemiology, clinical features, agent features, or lab diagnosis. They'll ask you more in the lines of elimination or PSM kind of answers they'll ask here. Right? Now describe mode of infection, clinical manifestations of cryptococcus infection. So describe the role of rapid diagnostic test. See, cryptococcus is being commonly getting repeated, and in cryptococcus there is a cryptococcal antigen test which is very fast in results, rapid in results, less costly, convenient test which is available now in comparison to the other examinations like culture, cryptococcal electron microscopic examination followed by the culture, right? So all these tests are the old class methods. Okay, those are conventional tests, but rapid diagnostic test based on cryptococcal antigen test or assay is the most latest one. So this will conclude microbiology, and finally forensic medicine. Less weightage is given to forensic medicine this time. So they have given only 45 marks weightage. In forensic medicine, classify poisons was one question which was already asked in 2023. But describe the legal duties of a medical practitioner in case of suspected poisoning is the latest area where you have to mention the latest legal sections associated with examination of a poison case. Now, drowning, unasked question. We were expecting the question of drowning, and the topic is incomplete without a note on diatom test. Okay, diatoms will help in ruling out Antemortem versus postmortem drowning. Okay, in medical legal significance, we already discussed about the atom test, but they're asking you the limitations of this test, which you need to know. Now, injury hurt, grievous hurt, you need to mention the BNS relevant sections, and medical legal aspects of contusion or bruise is already recently covered in the revision batch. That is, the age of a bruise will help in determination of the injury date. Now, various tests prescribed for blood and seminal stains, like there won't be any exam without a question on these, right? Blood stain examination, like you have crystal tests, Takayama test, right? And also seminal examination, acid phosphatase test, etc. Right? So this will conclude paper 1, section A and B of all the subjects. So let's take a small break and let's quickly jump into the paper 2 starting from general medicine. So about paper 2, in comparison to paper 1, paper 2, many of the students they felt that it was on the easier side and there are not many clinical vignetic questions. Diagnosis is straightforward. None of the times examiner was playing with the diagnosis and they missed out on psychiatry. They didn't ask any questions on psychiatry. And Dharma, we were expecting a bigger weightage, but only 30 marks weightage is given to Dharma. And a lot of questions came from general medicine. So in general medicine, one very commonly predicted question is prevention of coronary artery disease. You know how important it is because the leading cause of death in India is CAD. And as a doctor, they would expect you to know what are all the preventive measures or lifestyle interventions you bring in. But see, it's a common question. Every year they'll ask this question, but you have to bring in some your own USP for these answers to make them interesting. You might need to add some epidemiological points and you might need to refer to even PSM as well, wherein these kind of preventive interventions are well covered. Right. Next question is what is the role of various imaging modalities in the diagnostic evaluation of pyelonephritis, which is again part of the syllabus. So from imaging point of view, medical imaging, every year they're coming up with a surprise question like this in question number 1. So somehow you need to know the diagnosis part of general medicine better to be able to answer these kind of questions. Now next is 23-year-old woman with type 1 diabetes mellitus, high sugar, ketones positive, simple diabetic ketoacidosis, stepwise approach in management for 20 marks. I think there won't be any exam without a question on TB. There won't be any exam without a question on diabetes mellitus because diabetes mellitus is the leading cause of kidney disease. Diabetes mellitus is the most common chronic disease in the community apart from hypertension. Right, every year in 2022, 2017, 11, they have asked a question on DKA management. And in course of regular test series and everywhere, wherever I asked a question, I predicted a question on diabetes ketoacidosis. But it's very important that you have to write a stepwise approach to the diagnosis and management. Okay, you can't just jump into the management. First you have to have a approach to the diagnosis. How will you going to approach, how are you going to rule out the differential diagnosis, and what are all the steps in management? First we hydrate, then we start insulin, then if needed we'll add glucose, we'll check for the potassium level. So each step is important. Now, elaborate indications for initiating antiviral therapy in a patient with chronic hepatitis B. And what is the first line drugs in management of chronic hepatitis B? So, almost 25 mark questions. So, look at the weightage. I don't know how you're able to cook this answer, but hepatitis B and C management I covered in very greater detail in the regular. Almost everything from Harrison I was able to discuss. Luckily, that came in handy this time because we were not just doing this topic superficially. Hepatitis B, we went into a greater depth. I have given you all the parameters that we check. We'll check ALT, we'll check the viral load. Based on that, we'll decide which drug to give. Everything in a tabular form is given in the notes. Okay, for 25 marks, it's a big weightage. Now this one for 10 marks and 15 marks, almost 25 marks, AML and ALL. AML and ALL, the key differences and how do you manage ALL is covered, very well covered in the pathology and general medicine part of leukemia. Now discuss the diagnostic approach to and curative management of renovascular hypertension, unasked version question, renovascular hypertension. We covered it in the DAWP. Okay, so very important. Any topic which is not asked so far can be a potential question in the future. So this will conclude general medicine, simple. Dermatology only 30 marks. So the three diseases which are covered in dermatology are scabies, eczema. But one confusion or one takeaway here is instead of just asking psoriasis, there are clinical variants of psoriasis. That is, you will have pustular psoriasis of pregnancy called dermatitis herpetiformis. You will have in the psoriasis, we will have an inverse psoriasis. In the psoriasis, the regular form, the plague type psoriasis or psoriasis vulgaris is there, right? So there are many variants of psoriasis, and in that they have given a clinical scenario that is 28-year-old female, known case of psoriasis. Suddenly now symmetrical pustules, that means pustular psoriasis with high grade fever came into the picture, and these are symptoms are seen in third trimester. So we can't give retinoids, which are the root cause of treatment of pustular psoriasis. So you might need to give something else. That is a part of this question. How will you manage? How will you diagnose? And what are the complications? So this is a case of pustular psoriasis of pregnancy. Apart from that, eczema is a lot of times covered, and this is very like there is a YouTube video from my end in detail covering difference between allergic and contact dermatitis. That video might have given you the 4 marks. Now, scabies treatment is different in antenatal women, treatment is different in 1 month old infant, and treatment is different in age old patients. So, similar question came in the past. So, they're asking you how will you treat scabies? For example, in 2012, they asked a treatment in neonate, child in less than 2 years, and adult and a pregnant female. The same question in a different form is given in 2025, and they're also asking you how is this disease transmitted with the help of Sarcoptes scabies. Now, eczema and dermatitis are two parts of the question. So, classification of eczema is asked in 2012, and differentiating irritant and allergic contact dermatitis are asked in 2013. And after a long, this question is getting repeated in 2025 again. Right. So, this topic I already told you 28-year-old female with psoriasis, that is pustular psoriasis of pregnancy, also known as impetigo herpetiformis. So, that means any variant of psoriasis and its presentation and its treatment going to be an important part of our predictive way to learn psoriasis topic for future. Pustular psoriasis of pregnancy. Now, dermat is done. Pediatrics, very easy and predictable. I felt very happy because, see, this ARI program is already asked in CMS exam. So I have included this in the regular discussion as well. And there is a detailed video between ARI program of WHO versus the similar approach in case of IMNCA, because last year they asked about IMNCA guidelines, and this year they are specifically asking about WHO, and then there is a change. There is no chest in drawing now. And based on this change, every year, NEET PG, CMS, INS, ET, even medical science optional, they're asking a question. So, not to get confused, there is an update, and ARA program is important for 10 marks. Similarly, there is a question on SAM. This is also important. Last year, they asked a question on SAM and they asked about diet part. What is this F75 and F100 diet? They asked it in greater detail. So, SAM has 10 steps of treatment. So, this year, they asked a step on hypothermia. So next year they can ask a detailed on hypoglycemia, or they can ask in detail on management of the infection. So all the 10 steps in detail can be a potential question, because instead of asking what are the 10 steps of treatment of SAM or what are the two phases, initiation phase and stabilization phase, they're not asking generic questions. If they ask generic questions, you can happily mention the 10 steps 1, 2, 3, 4, 5. But each step they're asking for 10, 20 marks. So that means you need to know how to manage hypothermia, you need to know how to manage hypoglycemia, you need to know how to manage the infections in this case, how to give sensory stimulation, how to follow up the case. Each step you need to know in greater detail when you're managing severe acute malnutrition child. Right. Now, diarrhea, important topic. You need to know the definition, causes, and assessment of dehydration. That is no dehydration, some dehydration. severe dehydration. The classification is important, and the nutritional management and steps for the prevention of acute diarrhea all are an important part of this question. And diarrhea, we all know childhood diarrhea is an important topic from pediatrics. Apart from diarrhea, respiratory distress syndrome is another condition which is also important. You need to know the differential diagnosis. What are the causes of respiratory distress, of cardiac and non-cardiac cancers, and what is how will you manage, and what are the risk factors is the question. And respiratory distress syndrome is an important part of pediatrics. Now, immunization is there in the syllabus. They are asking you every time what is the national immunization schedule in detail. But instead of asking the whole schedule, now they are only asking what type of vaccines are included in it. And what happens if you take, what is the adverse event following immunization. AEFI is an important topic. And also, they're asking you to write at least three adverse events of any of the three vaccines. You can pick any of the three vaccines from the previous year questions and you can do that. So, these are the questions from vaccination part. So, this will conclude our paper 2, section A, general medicine, dermatology, and pediatrics. I think it looks predictable and familiar, not much unasked questions, right? Now, general surgery weightage is 70 marks, and general surgery is one area they ask lot of unasked questions. Like they asked a question on peritonitis, which is again peptic ulcer perforation peritonitis, which we already covered in the regular course. They asked a question on cleft palate, which is again important, unasked question. They asked a question on ulcerative colitis. I was expecting a question on ulcerative colitis, and last year it came. But this year, ulcerative colitis, they're also asking Crohn's disease. So, though in the syllabus of UPSC Medical Science optional, they mentioned ulcerative colitis as a topic, but ulcerative colitis versus Crohn's disease is also important. And like you're not even a doctor if you don't know, or if you're not even in the right frame of mind to write a competitive exam if you cannot differentiate these two inflammatory bowel diseases together. Okay, you can't just do it for an exam sake. You need to know, like it's a dictum topic, it's a golden topic. Though chronic Crohn's disease per se is not particularly there as a part of general surgery, but Crohn's disease is already there. Crohn's disease is already there as a part of malabsorption syndrome of general medicine. So they might have integrated that with here, right? Ulcerative colitis versus Crohn's disease. And also the one more question on anal fissure, which we are able to cover, but it is again a gray zone topic. Okay, and also laparoscopy. We're not expecting a question like this, but there was a certain question on laparoscopy. Almost general surgery for a person who is not well prepared, or a person who is not focusing on unasked version, or for a person who is not part of UPSC Medical regular course, it's gonna be a nightmare because there's not even a single question from varicose veins or peripheral artery disease or a breast cancer or a carcinoma, which are the dictum topics which we usually expect from general surgery, but they went ahead and they asked all unasked questions, including laparoscopy. And you know, for a general surgeon, how important it is to have a laparoscopy knowledge, because each general surgeon would love to become a laparoscopic surgeon. And laparoscopy gives them a minimal invasive in nature, less complications, easy return to the regular work, right? Maybe expensive, needs expertise. So they're asking you advantages and limitations of this, and how will you create pneumoperitoneum also is the question they're asking. Right now, etiology, clinical features, and management of anal fissure is one question. Clinical features and management of ulcerative colitis, difference between ulcerative colitis and Crohn's disease, clinical features and diagnosis of peritonitis, management of peritonitis, complications of peritonitis, embryogenesis, clinical features and principles of management of cleft lip. Though these are all unasked, I was able to cover all these things in the regular course and also in the test series, thinking that general surgery has huge syllabus, and general surgery is one area where you have so many unasked topics yet to be asked. So because there is a scope to ask so many unasked questions, they went into greater detail and they tried to cover almost 5 out of 6 questions which were not repeats with regards to general surgery. And the next subject is OBG. OBG also on the moderately difficult side. This pelvic endometriosis was a shocker for me because chronic pelvic pain is there, but cause as a pelvic endometriosis I couldn't predict. But hypertensive disorder, eclampsia, preeclampsia, we all know how important these topics are. And anything regarding infertility, the definitions of infertility, and how will you investigate tubal factors of infertility, and what are the various ART procedures. All these are previous year repeats which are part of the previous year question. And also WHO medical eligibility for contraceptive use, what is the complications of IUCD, how will you manage a misplaced copper, are the questions from the IUD part. So these are the simplest very simple questions, not tricky with regards to OBG. So not many difficult questions with regards to OBG. Now finally, we're coming to the PSM part. PSM, students were very happy with regards to PSM because we had a updates 2025 discussion wherein we covered this question, we covered this question, we covered this question, and also we covered this question in detail. The only thing which we mixed is Kilkari initiative and also parameters employed for epidemiological surveillance. Apart from that, the whole is a part of recent discussion, updates 2025. So for the next batch also, I'll do the same thing, updates 2026. If you're able to crack PSM, we are like when I started this institute in 2019, the biggest stress for me was to give you the up-to-date content with regards to preventive medicine, because at the end of the day you are preventive doctors, you are future civil servants, your approach should be more in the preventive lines. If you can't crack with PSM, which is close to your national health programs and also GS study, what is the point of me being here to help you out, right? So that's why I took it as a challenge, and we are able to kind of cover almost all except the Kilkari initiative. I thought Kilkari initiative is there in the book PSM. Only 2 lines are there, but I don't know how he was able to add 10 marks. But when I went into research, it is close to MCTC, which is already asked. So for the next year, I would like to predict 2 or 3 similar topics so that you will not miss out on 10 marks, right? Chalo. Then there is a in for MMR point of view, they released a recent that we were able to get below 100, and it's a very good achievement, SDG 3.3. And I made a detailed discussion on what is India doing to reduce the maternal mortality rate. I'll try to upload this video in the YouTube as well for the general audience who are not part of my course. They'll get a brief idea how we were able to predict that, because I follow a lot of PBA, Press Bureau of India publications, wherein if there is any health related publication, I'll just deep dive into it. So this question is taken directly from the Press Bureau. Now, similarly, there was this Kilkari initiative. We already had a lot of Kilkari in the brain, right? Because of that, I was not happy that they asked that question, because I was expecting some Suman scheme, which is new. I was expecting Pradhana Mantri Surakshit Mantritva Abhiyan, which is again new PMSMA. These are all trending programs, but somehow they asked this e-message wala stuff. Home-based newborn care versus home-based care of young child was like a detailed discussion is part of the course, and they're asking similar home-based from the CMS as well. In the CMS, the question got repeated. Now, a lot of times I told you CMS because I also refer to CMS to predict future, because both CMS and CSE, the exam board is same, the same CGHS, Ministry of Health and Family Welfare. Anemia Book Bharat, always and always every year, 666, 6 interventions, 6 goals, etc. is very important. Now, National Framework for Elimination of Malaria in India, 2030. Even in 23, they asked a question. So the question got repeated here again, right? So this will conclude our discussion on the whole paper, detailed analysis of the paper. Now, I would request the 2026, see first 2025 mains going aspirants, if you have felt that exam is out of the box, I will not agree, because even now 80% of the questions are PYQs. Maybe not direct repeats from 2020 to 2025, 2024, but many of the questions are from 2013 to 2019. That means only 5 years is not enough. You have to do 10 years, and only PYQs is not enough. You have to catch hold of topics and do it in detail. I think my course, UPSC Medical course, is built from 1994 onwards. That's why my strike rate is 90%. What I'm doing is I'm covering old 80%, and I'm also predicting 15 out of 20% of new topics. That is unasked versions. So that's the reason my strike rate is 96%. If you do not have financial constraints, if you want best guidance for medical science optional, you have to blindly join either combo course or foundation course. Later on, whenever time permits, you have to do a little bit research. So what I will do after the paper analysis now is that I will include all these predictive topics in bits and pieces in various courses. I will give separate handouts. I'll upload videos for that, so that the 26 batch is without much effort, subconsciously, involuntarily, they are ready for 26 attempt in the best way possible. And among all the optional papers I have analyzed, the easiest one is again medical science only. Because the other optionals are purely subjective, lot of analysis, and the closest optional which many medical students choose is anthropology. Anthropology was a nightmare. Anthropology was a nightmare for last three couple of years. So after this paper, after looking at anthropology in last 1 week after the mains, 76 students have called me and they have migrated from anthro to medical science, and they are now part of UPSC Medico courses. Usually, I never ever kind of talk about these kind of stuffs openly, but if you are still in a dilemmatic situation, thinking that with a mob mindset, I will stick to anthro, even though the exam is tough. Look at this information. Don't miss the train. This is the time to jump back to your mother subject, or go back to your heart and listen to the heart. And this is the time to pursue your medicine again, because exam is tough. This works as a very good plan B. And if the papers are deep, conceptual, if an optional paper is not just based on PYQ, they're asking something else, then medicine is your best shot because you have some foundation in it. At least you can write something there. Something is better than nothing for this exam. Like if you go for subjects like anthropology, sociology, geography, like if you know something, it's okay. If you don't know, like you can't even write something for 1 mark. At least medicine you can write for 3 to 4 marks. Maybe that could be the reason. When I started this institute, I had 4 ranks. Now last year I got 37 ranks. I think there is a very big jump in total number of students who are actually getting into the list. That means medical science is the safest optional with till date 80% of the questions which get repeated. There is no subjectivity. It's a purely objective optional. If you know, you'll know. Even if you don't know, you have basic strong. That is, you are from MBBS, you can write something. On top of that, I am able to give you 94% predictive paper. I am able to guide you. We have multiple courses. So there was a rumor that there is no mentorship for medical science, but now with last 6 years of my strenuous work, I was able to fill in that deficiency or gap. So even if you're not much confident about medical science, just jump in here. I am here to help you out. Right? So don't commit a mistake of choosing a subject which is not your graduation subject. So when exams become tough, when they ask you subjective questions, analytical questions, deep conceptual questions, if you're not from that particular background, if your graduation knowledge is not from that particular background, there's no point of wasting so much of time. Go back to basics. Better to deal with the devil you know, that is your medical science. I'm always here to help you out. Okay, just give me a call. This is my number, 8978 444 188. Just a WhatsApp message or a call. I will guide you personally. I will help you to pass through this dilemmatic stage. Okay, this transfer of one optional to other is a tricky and little annoying thing. Okay, not an easy option, but definitely I'll help you to sail through. Right? So for 2026 batch, I think I'm in the right line. I'm reading the examiner mindset. I'll be coming up with the best prediction possible, best test series, best evaluation, best mentorship, best videos, and best updated notes in future along with the handouts. Okay. So I said that 6 years back, I'm here to stay. Year by year, we as a team are growing, but we are still carrying that same hunger to help you people to crack this medical science option and also to crack UPSC. Right, almost 100 plus students have attempted this mains 2025, and many were happy, and they're saying that everything is from the notes and the videos. So I think we are expecting a very good result even this year. So again, it's not about the result, it's about the right mentorship, right guidance, and the right resources. So everything is going right with UPSC Medico, and it is now your job to get into this train without delaying much. Okay, signing off, your Dr. Naveen from UPSC Medico.